Heart attack and stroke are the world number one killers. Until today, 19th July 2020, 5.1 million people died because of heart attack and 3.6 million people died because of stroke. Do you know if 30% or the more blood losses from a human body, there are the chances of death very quick and require transfusion of packed red blood cells for resuscitation. Loss of 10% of total body water can cause physical and mental deterioration, and loss between 15 to 25% cause death. 30% of burn can be potentially fatal. You are watching Safety First, and this is part 2 of Basic First Aid. I'm your host Javed. If you are new on this channel, kindly subscribe and share. What is bleeding? Bleeding is simply loss of blood from the body due to any act, effect, or process. Bleeding might be internal or external. Internal bleeding means the blood escapes from the circulatory system but remains inside the body. Sometimes signs of internal bleeding can be visible, such as when the casualty coughs up blood or vomits blood, but most of the time internal bleeding is not apparent. But on the other side, external bleeding, where blood escapes from the circulatory system to the outside of the body. For example, from a wound, cut. How to control bleeding? There are four methods to control bleeding: by applying direct pressure, elevation, indirect pressure, or tourniquet. What do you understand by direct pressure? Direct pressure is the first and most effective method to control bleeding. Place sterile dressing or clean cloth on the wound. If bleeding is not controlled, apply another dressing of the first or apply direct pressure with your hand or fingers over the wound. Second one, elevation. Raising of an injured arm or leg extremity above the level of the heart will control bleeding. But don't elevate if you suspect a broken bone, fracture, until it has been properly supplemented. Indirect pressure. How to apply? Third method of indirect pressure. In case of severe bleeding when direct pressure and elevation, number one and number two methods are not applicable. To control the bleeding, indirect pressure must be used. Pressure is applied with the fingers, thumbs, or heel of the hand. Indirect pressure is used in addition to direct pressure and elevation. Pressure points in the arm and in the green, more often used. What is tourniquet? Number four, process or method to stop bleeding. A tourniquet should be used only as a last resort to control severe bleeding after all other methods have failed, and is used only on the extremities. A tourniquet can be strap, belt, towel, or other similar item. Never use wire, cord, or any material that will cut the skin. Place the tourniquet between the heart and the wound, leaving at least 2 inches of the uninjured skin between the tourniquet and the wound. Place a pad over the artery. Wrap the tourniquet around the extremity twice. Place a short stick. Twist the stick to tighten until bleeding is controlled. Secure the stick in place. Never cover a tourniquet. Make a T on the casualty's forehead at the time tourniquet was applied. Never loosen or remove a tourniquet. Even though you applied any type of method, still you need to consult the doctor. Internal bleeding. What is internal bleeding? The most common sign of internal bleeding is a simple bruise contusion. It indicates bleeding into the skin. Severe internal bleeding occurs in injuries caused by a violent force, vehicular accident, puncture wounds with knife or any sharp object, and broken bones. What you will do if you suspect internal bleeding? Bruise, contusion, apply ice or cold pack with cloth to prevent damage to the skin to reduce pain and swelling. Severe internal bleeding, you have to call emergency services or professional medical team. Monitor airway, breathing, and circulation. Treat for shock. Place casualty in most comfortable position. Maintain normal body temperature. Reassure casualty. What is nasal bleeding? Nosebleeds can be caused by an injury, disease, or the environment, high blood pressure, and changes in altitude. If a fractured skull is suspected as the cause, don't stop the bleeding. Cover the nose with a loose, dry, sterile dressing and call the local emergency services or the medical staff. What precautions are required if there is nose bleeding due to other reason? Keep the casualty quiet, sitting with head tilted forward, pinch the nose, shut, place eyes and cold packs to the bridge of the nose. If the casualty loses consciousness, place them on their side to allow blood to drain from the nose and call the emergency services or the professional medical help. What are soft tissue injuries that cause a break in the skin? Underlying soft tissues or other body membrane are known as wounds. Injuries to the soft tissues vary from bruises to serious cuts, lacerations, and puncture. There are two types of soft tissue injuries, open and closed. What are closed wounds? A blunt object that strikes the body will damage tissues beneath the skin. The wound is called bruise. Hematoma are the result of severe blunt injury with extensive soft tissue damage, tearing of large blood vessels and pooling of large amount of blood below the skin. With large hematomas, look for broken bones, especially if deformity is present. What are open wounds? What's the meaning of open wounds? In open soft tissue injuries, the protective layer of the skin has been damaged. This damage can cause serious internal or external bleeding. There are 6 basic types of open wounds: abrasions, amputations, avulsions, incisions, lacerations, and punctures. We'll see one by one what is abrasion. Abrasions are caused when the skin is rubbed or scraped off. What is incisions? Incisions, commonly called cuts, are wounds made by sharp cutting instruments such as knives, razors, or broken glasses. This is more deeper as compared to abrasion. What is laceration? Laceration are wounds that are torn rather than cut. They have ragged, irregular edges and torn tissues underneath. Punctures. Punctures are caused by nails, needles, wire, knives, and bullets. Amputation. Loss of an extremity or a part of it. That is amputation. Severe case. Severe injury. What will be the responsibility of a first aider while treating the wounds? His primary duty is to control the flow of blood, treating for shock and preventing infection. Many wounds contain foreign bodies, wood or glass splinters, bullets, metal fragments, wire, fish hook. The general rule is remove foreign objects from the wound only when you can do so easily and without causing further damage. Don't attempt to remove any object in the eyes or that has penetrated the eye. How to deal with the eye wounds? Foreign bodies such as particles of dirt, sand, paint chips, or fine pieces of metal frequently find their way into the eyes. Never let the casualty rub the eye, since rubbing can cause scratches and can push a foreign body deeper into the eye, causing further damage. Gently flush the casualty's eye with water at least 15 to 20 minutes. If flushing the eye is not successful in removing the foreign body, patch both the eyes and send the casualty to the doctor, hospital. In the case of head wounds, an open wound, there is an obvious injury in which there is normally a lot of bleeding. Closed head wound may not be obvious. Many times you will have to treat the casualty based on how the accident happened. You may see only the delayed symptoms, such as seizure, confusion, or personality changes. If you suspect a head injury, what you have to do: position the casualty flat, stabilize the head, and establish and maintain airway ABC. Finger sweep to remove any foreign bodies from the mouth. If you can see, maintain a neutral position of the head and neck. If possible, apply a cervical collar. Control bleeding using gentle, continuous pressure. Never apply direct pressure if the skull is depressed, a bone fragments are seen. apply dressing, treat for shock, and call the emergency services. Accident cause many different types of injuries to bones, joints, and muscles. Broken bones, fractures, dislocations, sprains, strains, and bruises, contusions. When in doubt, always treat the injury as a fracture. Primary process of first aid for fracture consists of immobilizing injured part to prevent the ends of broken bones from moving and causing further damage to the nerves. Blood vessels are internal organs. In an emergency, almost any firm object or material will serve as a splint. The primary purpose is to stop the bleeding. What is fracture? Any breaking, bending, dislocation, or cracking of bone is called fracture. What are the types of fracture? Types of fracture includes closed or open, compound, complicated, comminuted, depressed, impacted, and green stick. Once you are at sea, there is pain, deformity, discoloration, and swelling. It is not easy to recognize. When in doubt, split. If you suspect a fracture, your prime objective must be to control the bleeding, treat for shock, monitor the airway, breathing, and circulation, remove all jewelry from the injured site, cover all wounds with sterile dressings, including open fractures. Don't push wound ends back into the skin. Apply splint. Don't attempt to straighten broken bones. As soon as possible, try to shuffle the casualty to the hospital. What is strain? A strain is caused by the forcible overstretching or tearing of a muscle or tendon. They are caused by lifting heavy loads, sudden or violent movements, or by any action that pulls the muscles beyond their normal limits. The primary symptoms are pain, lameness, stiffness, swelling, and discoloration. What is contusion? A contusion is an injury that causes bleeding into or beneath the skin, but it doesn't break the skin. Primary symptoms are pain, tenderness, swelling, and discoloration. At first, the injured area is red due to the local irritation. As time passes, black and blue marks appear. Several days after the injury, the skin becomes yellow and green in color. What is sprain? A sprain is an injury to the ligament that supports a joint. Sprains are caused by the violent pulling or twisting of the joint beyond its normal limits of movement. The joints that are most frequently sprained are the ankle, wrist, knee, or fingers. If you suspect a sprain, as a first aider, you have to splint to support the joint. Elevate and rest the joint to help reduce the pain and swelling. Apply ice or cold packs with cloth to prevent damage to the skin. The first 24 hours and then apply warm compresses to increase circulation. A request for medical assistance. Treat all sprains as fractures until ruled out by X-ray. Now we'll discuss about burns. What are burns? Burns are classified according to their depth as first degree, second degree, and third degree. First degree burns involve only the first epidermal layer of the skin. The skin is red, dry, warm, sensitive to touch. Healing occurs naturally within a week. Second degree of burn involve the first and part of the second dermis layer of the skin. The skin is red, blistered, weeping, and look spotted. Pain is moderate to severe. Third degree burns are light threatening. Third degree burns involve all layers, full thickness of the skin, penetrating into muscles, connective tissues, and bone. There is a rule that is called rule of nines. The rule of nines is used to give rough estimate of the surface area burn and aids in deciding the correct treatment. Shock can be expected in adults with burns over 15% or in small children with burns over 10% of the body surface area. Causes of burns are classified as thermal heat, chemical, electrical, and radiation. So these are the four ways by which most of the burns are occur. Thermal burns are caused by exposure to hot solids, liquids, or gases. as a first aider. You need to monitor the airway, breathing, and circulation. Control bleeding using direct pressure, elevation, indirect pressure, or tourniquet if indicated. Remove all jewelry from the area. Swelling may develop rapidly. Apply cool water to the affected area or submerge in cool water. Don't use ice or ice water. Remove clothing gently from the burn area. Don't remove clothing that is sticking to the skin. Cover area with dry, sterile dressings if possible. Cover large areas with clean, dry sheets. Don't break blisters or apply creams of any kind. Treat for shock and request immediately for medical assistance. What are chemical burns? When acids, alkalis, and other chemicals come in contact with the skin, alkali burns are usually more serious than acid burns. Alkalis generally penetrate deeper and burn longer. If the casualty has chemical burns, as a first aider, you have to flush area immediately with large quantities of fresh water using an installed dilute shower or hose. Avoid excessive water pressure. Continue to flush the area for at least 15 minutes. Dry lime powder creates a corrosive substance when mixed with water. Keep the powder dry. Remove it by brushing it from the skin. Acid burns caused by carbolic acid should be washed with alcohol. Flush the eyes with fresh water immediately using an installed emergency eye face bath or hose on low pressure for at least 20 minutes. Monitor the airway, breathing, and circulation. This is the number one priority. Warning, don't attempt to neutralize any chemical unless you are sure what it is and what substance will effectively neutralize it. Treat for shock and immediately request for medical assistance. What are the electrical burns? Electrical burns may be more serious than they first appear. If you find a person with electrical burns, you have to switch off the power first, maintain a neutral position of the head and neck, apply cervical collar, establish and maintain the airway, breathing and circulation, begin CPR, rescue breathing immediately, cover burn area with the moist, preferably sterile dressing, treat for shock. Shock is always fatal and request for medical assistance as early as possible. Now we will discuss about poisoning. Poisoning can be defined as a foreign substance that enters the body by means of ingestion, inhalation, absorption, or injection, which in sufficient quantity interferes with the normal body function. Ingested poisons can result from improperly stored foods, household products, or commercial substances used aboard ships. If you suspect poisoning by ingestion, you have to monitor the airway, breathing, and circulation. Position the casualties sitting and leaning slightly forward to prevent aspiration of vomit into the lungs. Obtain, if possible, all containers the substance was ingested from. If the casualty vomits, obtain a sample. Contact the emergency services. Ask immediately for medical assistance. Inhaled poisons that can be possible through routine cleaning, painting, and preservation produce toxic vapors, gases, and dust. If you suspect inhalation poisoning, you need to remove the casualty to fresh air, loosen clothing around the neck and chest, monitor the airway, breathing, and circulation, treat for shock, position the casualty sitting and leaning slightly forward to prevent aspiration of vomit into lungs. Immediately contact to emergency services for assistance. Injected poisons, injection of venom by stings and bites from various insects, while not normally life-threatening, can cause an acute allergic reaction that can be fatal. Any allergic reaction can develop into anaphylactic shock. Poisons also may be injected by snakes and marine animals. If there is snake bite, you need to move the casualty away from danger. Calm and reassure the casualty. Immobilize the casualty affected extremity, keeping the area below the level of heart. Remove jewelry from the affected area. Apply a constricting band 2 or 4 inches above the fang marks between the bite and the heart. Suction the bite with the mouth is recommended only as a last resort. Suction after 30 minutes is ineffective. The venom has already diffused. Monitor the airway, breathing, and circulation. Treat for shock. Never apply ice to afflicted area. Contact for emergency services. We are watching Safety First, and today we are discussing about basic first aid. The last topic is heart failure or heart attack. What is heart failure? Heart failure means heart is not able to pump adequate supply of blood to other organs of the body. Without sufficient and required flow of blood, major organs of the body will be disrupted. What are the causes of heart failure? A heart attack occurs when the coronary arteries, which supply the oxygen enriched blood to the heart, become blocked. Other possible reasons might be heart valve disease, high blood pressure, emphysema, diabetes, overactive or underactive thyroids, severe forms of anemia, use of drugs or misuse of alcohol, unhealthy cholesterol levels, smoking, obesity, and physical inactivity are also the contributory factors for heart failure. How to recognize that the person is under heart attack? Tightness and pain in the chest. The casualty may be clutching the chest. Possible spreading of pain to the arms, neck, and back. Dizziness or light-headed feeling. Shortness of breath and loss of appetite. Irregular pulse or persistent coughing. May have cold sweats. Let us see how we can reduce the risk of heart diseases or heart failure. If you control blood pressure, control your cholesterol level, control diabetes, control your weight, stay at healthy diet, manage your stress, not to smoke, manage alcohol and get a regular exercise, avoid energy drinks, fast food and packaged snacks, and drink plenty of water. You can minimize the risk of heart disease. Lastly, if your heart problems are known, take your medicines as directed by the physician, as directed by the cardiologist, as directed by your doctor. Remember, as a first aider, as a safety practitioner, incident record keeping is very important and it's a legal requirement. After any first aid incident, it is important that it need to be recorded and reported. The report should be clear and concise. First aid incident report shall be circulated as per the legal and contractual requirements to all the concerned authorities as directed and agreed by the organization. Usually there are forms in the different organizations and it need to be filled correctly and circulated as discussed. Dear fellows, the purpose of the life is to believe, to hope, to strive and thrive. Hope costs you nothing, but it keeps you alive. Part two of the training is over now.